I'm Rob Harwood. I'm the chair of the BMA's UK Consultants Committee. You'll know well that this year has seen an unprecedented national emergency in response to COVID-19. You'll also know that consultants' response to the pandemic has been absolutely extraordinary, truly exemplary, going far above and beyond anyone's expectation at a time of national crisis. It's truly been a year where the worth of consultants has been so starkly demonstrated as leaders and innovators in health, the people who can and do. We've tried hard to ensure that we've supported the extraordinary work that you've done so that you can carry on in your usual exemplary way. The BMA's Consultants Committee is the only body that represents all consultants in the UK. We take on board a large programme of work annually on behalf of consultants across the breadth of the work that you do. Our members of committee are drawn from across the UK. We try to ensure that we're connected to our consultant membership. The committee is drawn from the BMA's regional consultants committees, from devolved nations, as well as from the BMA's annual representative meeting. We work alongside national consultants committees in Scotland, Wales and Northern Ireland. We've taken on a wide programme of work, and I can only give you a sample of such work in a presentation as short as this. We've lobbied hard on pay awards for consultants, both to the government and to the DDRB. While the pay award for this year was acceptable, it's unacceptable that consultants' pay has not been properly valued, either by the government or by the DDRB over the past years. And this must be rectified. At present, we're in contact with members, taking their views about the DDRB, and in particular about the value of their own pay. You'll know, I hope, that the Consultants Committee has undertaken a huge amount of work in recent years on pensions. While the BMA's work on pensions sprang out of our committee, it became an effort across the entire association for the benefit of all doctors. And it was gratifying that after sustained lobbying from the BMA, the government announced in March an increase in the threshold income to £200,000, meaning that the majority of consultants will no longer be unfairly penalised and effectively paying to go to work. We're also working with NHS England, Health Education England, Royal Colleges and others on workforce planning. This has been a long-term issue, thrown into highlight by the COVID-19 crisis and the mountain of work that the NHS now has to accommodate. While consultants are tirelessly hard-working in order to address the current challenges, it's clear that short, medium and long-term solutions are urgently needed and that the consultant workforce must be grown over time. We're also working on addressing equality issues across the BMA, and the Consultants Committee is taking a lead on this. We want to ensure that, going forward, we're truly reflective of the membership that we serve, and we're working hard to make certain that we reflect the wonderful diversity of the consultant workforce. In addition, we're working to help address the challenges faced by disabled doctors working in healthcare in the UK. And we've also recently worked on challenging the culture on menopause for working doctors to help improve the working lives of all of our workforce. We've worked hard over the period of the COVID-19 pandemic on topics thrown up by its emergence. We've all been shocked by the huge impact of COVID-19 on Black, Asian and minority ethnic colleagues. And while it's still not clear where the origin of that increased impact stems from, we've lobbied hard and secured both a national inquiry and a risk assessment framework for medical staff across the NHS. We've contacted all Trust Chief Executives in England on multiple occasions, pressing for the introduction of risk assessment tools. You know, I hope, that the BMA has been at the forefront of raising concerns around personal protective equipment provision. The BMA has been instrumental in ensuring that consultants have been properly protected while working in environments that risk their own health. The BMA and the Consultants Committee within it has lobbied hard for an extension of death in service benefits. And that's been realised, at least in part, for all doctors and also for all other NHS workers. Our lobbying has helped not only consultants, not only doctors, but all other workers across the NHS. We've also lobbied hard to increase the provision of COVID-19 testing to ensure easy availability and access for doctors and their families. It's also clear that there's an opportunity for change within the NHS as a consequence of the COVID-19 crisis. We're working closely with our colleagues in primary care to try to change some of the ways that the NHS works, to allow consultants and GPs to work more closely together, to make it a more productive environment with more effective use of resources. There's plenty to do in the coming year, and there will be many challenges that have yet to present themselves. The NHS is in a very difficult position currently, with a historic backlog of cases that's become unimaginably larger in recent months. Health systems must reach out and truly involve the consultant workforce if there's to be any hope of addressing this mountain of work. Consultants need to be valued for the work they do on behalf of their patients, and that must start by addressing the huge fall in the value of your pay over the last 10 years. The COVID-19 outbreak has emphasised that the current consultant contract is not always suitable for the working patterns of the current workforce. It needs revision, and we'll take that forward. We're taking it forward at a time when it's becoming obvious that you aren't paid enough for the extraordinary work that you do. And moreover, talented and hard-working though you are, there are simply too few consultants to deal with the present backlog of work that must be addressed both immediately and into the long term. But there are other issues to address to allow consultants to demonstrate their full worth. One such example would be the reduction of time-consuming bureaucratic processes. Addressing this and similar issues will help make consultants' working lives both more productive and more fulfilling. The consultant response to the pandemic has been and continues to be truly exemplary. I think our whole country would want to thank you for the extraordinary and invaluable work that consultants do day in and day out. The UK Consultants Committee will continue to work hard representing the interests of consultant members across the country. We'll be here to support you in the months ahead and take forward those issues that will see you properly valued and properly rewarded. And last, I'd like to thank our officer team and BMA personnel for their invaluable work. To Phil de Warren-Penny as our Deputy Co-Chair for Negotiations, to Helen Fidler, our Deputy Chair for Development, Communications and Professionalism, to Vish Sharma, our Deputy Co-Chair for Negotiations, to Simon Walsh, our Deputy Chair for Healthcare Policy, and of course to Nikki McIntosh and Holly Senior, our Joint Head of Committee Secretariat, to Sam Allen, Dom Norcliffe-Brown, Ivana Mazurek, Johnny Carey, together with colleagues from Policy, from Pay and Contracts, from Comms and Media, for all of their incredible, invaluable help. Thanks so much for all of your very hard work. Thank you.